There's a secret group of just 16 people that quietly decide what preventative care every American gets and what your insurance company will actually pay for. And no, it's not the Centers for Disease Control, it's not Congress, and it's not even your insurance company. Now, this group updates a list continuously that determines what medical tests you can receive and which ones never even make it to your doctor's checklist. I'm Robert from Shameless Care, and I've spent years researching this very subject, so let's go ahead and get right into it. We're talking about the United States Preventive Services Task Force, which was founded in, wait for it, 1984. 1984, believe it or not, I kid you not, 1984, this group was founded. They're appointed by the Secretary of Health and Human Services, which as of right now is Robert Kennedy Jr. And I bet you knew that Robert Kennedy Jr. was the Secretary of Health and Human Services. I also bet you can't name who the last person was, because we all hear about Robert Kennedy Jr. all the time in the news. But this committee basically decides what preventative care you can get, and maybe more importantly, what your insurance company has to cover. When they were first founded in 1984, they did their work sort of quietly. Not that many people really paid attention to their recommendations, but when the Affordable Care Act was passed, then their recommendations became critically important, because that is when this committee went from, decide whatever you're going to decide, and whoever wants to listen to you can listen to you, to no, whatever you decide is covered by insurance has to be 100% covered by insurance. And that's when they became incredibly important and incredibly powerful. Now, this United States Preventive Services Task Force assigns everything a letter grade based upon their opinion of it, essentially, right? So they give it an A, a B, a C, a D, or an I. Now, grade A means this is fantastic. Everybody should get this. This can save a lot of lives. It's a slam dunk. There's no debate here. In fact, we believe in it so much that this needs to be 100% covered by insurance companies, no copay even allowed. An example of that is a colonoscopy. I'm 45 years old. Colonoscopies are recommended by the United States Preventive Services Task Force at 45 years of age. And so I just had that. Leave in the comments if you've had a colonoscopy, and if so, what you thought about it. If you haven't had one yet, let me know in the comments if you knew that you're going to when you turn 45, and good luck with that, by the way. If they give it a B rating, very similar, very high up on their list, also has to be covered by insurance companies. If they give something a C rating, that means, in some circumstances, it's a good idea. We'll leave it up to the physicians, but your insurance company doesn't necessarily have to cover it. They basically get to decide if they're going to cover it or not. A D rating means do not recommend, do not do. In that case, they believe that the harm outweighs the good. They think that preventative screening is actually going to do more harm than good. So they give it a D rating, do not do. For an I rating, basically what they say is there's just not enough evidence yet. This may turn out to be fantastic. We don't know yet. There's not enough information on it. So we're not going to take a stance on it one way or another. But generally speaking, those things that are rated I right now, my understanding, a lot of providers don't pursue those because they're not high up on the recommendation list. Now, the question that a lot of people have is, well, why doesn't the United States Preventive Services Task Force just recommend everything? Isn't more screenings better? You can imagine screenings for pancreatic cancer or oral cancer, or, I'm a 45-year-old man. Why aren't I getting a CT scan on my heart, for example? I could drop dead of heart disease at any moment, which is absolutely true, right? Well, there's a simple reality to this, which is nobody could afford all of those tests. My colonoscopy, I saw the bill from my insurance company, or from the hospital system, which is going to my insurance company, over $10,000. But the United States Preventive Services Task Force says that they don't pay any attention at all to money. They don't care about money. If they give something an A rating, the insurance company is just going to have to figure out how to pay for it. They don't concern themselves with money at all. What they concern themselves with is it good for the person or not? Because some screenings can actually cause a lot of anxiety. Some screenings can actually overdiagnose and lead to overtreatment. And some are very invasive and kind of downright harmful on their own. So they look at a litany of information and they decide. I'll give you an example from my line of work. So Shameless Care is a telemedicine company that deals with sexual health. That won't pertain to many of you watching this video, but that's okay. This example is just an example. Something that they give a D rating to, which I'll remind you means do not do, is asymptomatic herpes screening through a blood test. They say that the harm outweighs the good, and they list a lot of good evidence. And that's one of the things that I think is really important for you to understand is if you have any questions about this, every single decision that the United States Preventive Services Task Force makes is available on the internet, so you can look at it. So for example, with herpes recommendations, they actually list all the reasons why. They say that the testing can be flawed in a lot of cases, and they'll link to actual research study on those, statistics on that testing. And so their decisions seem to be pretty grounded, but not everybody agrees with all of them. And as we've seen recently with Robert Kennedy Jr. and vaccine recommendations and committees flipping and committees getting new people all the time, these decisions are made by human beings who are just as flawed as you and I. And different people can look at different research and make different decisions. And so these decisions, while something's an A rating, a B rating, a C rating, that is going to change in the future. And in fact, it changes all of the time. Another example that I can give you from my line of work is that as of right now, the United States Preventive Services Task Force says that there is insufficient evidence to recommend asymptomatic screening for gonorrhea and chlamydia for heterosexual males. They recommend it for women, but not for men. That doesn't make tremendous sense to me because I have actually had asymptomatic gonorrhea before and spread it to somebody else, and a proper screening could have prevented that. So that's one reason men do get this. But also, who do you think is giving these infections to women in most cases? It's men. So to me, it doesn't make sense to recommend those for women, but not for men. But like I said, these decisions are made by human beings. We have to basically stand by what they are as they are, but just understand that they didn't come down, from heaven. They're not chiseled onto a stone, and they're subject to change. So I hope you learned something. That is the United States Preventive Services Task Force. If your insurance company tries to get you to pay for something that is rated A or B, take them to task. I'm Robert from Shameless Care. We'll talk soon.